All right, this segment is sponsored by Charleston Orthodontic Specialists. From color braces and gold braces to clear braces that are practically invisible without a second glance, Charleston Orthodontic Specialists have you covered for back to school. Here with more is Sherry Thompson along with Chelsea Scott. First, we're going to talk today about this little thing that people put in their mouths, and it's a little rubber band, but it is so significant, isn't it?
Absolutely. So the first thing when people think of elastics, they think of what we call ligatures, which is the little colors that are attached to your braces that actually help your teeth move.
And helps your teeth move very slowly. It's not like you put them on and boom, there's the tooth moving. These come in ligatures. They come in a variety of colors, and I'm sure there's some really popular colors out there, right?
Absolutely.
Yeah, so if you look at this model right here, you can see that you can do all colors of the rainbow, but the wire is actually what moves the teeth, and the ligature, the color that you choose, is what attaches the bracket to that wire to make sure it's holding on so it will move it. And then we also have a variety of clear colors as well that we can put on our clear brackets for our older patients who don't necessarily want a bright color in their mouth.
And then there's some of the ligatures that go from the top of the mouth to the bottom of the mouth depending on what direction the different teeth need to go, right?
Absolutely. So you'll wear rubber bands, which are these that are connected from the top to the bottom. So if you had a underbite, which is where your lower jaw proceeds, you would wear them from the top to the bottom or from the bottom to the top. So depending on underbite or overbite, depends on where you wear your rubber bands, and those are very important.
Yeah, are rubber bands the only thing that are used with braces besides the brace itself?
Well, so a lot of people think that you can only wear these rubber bands with braces, but you can actually do it with Invisalign these days too. So what Invisalign does is they make little cutouts on the plastic trays that look like hooks so that the rubber bands can attach to it, and sometimes we'll put an actual tooth colored attachment on your molars or sometimes your canine teeth, depending on how you need to wear your rubber bands that do it.
What are some of the most popular colors with the kids these days?
Clemson is football's coming up.
Absolutely.
That's got to be huge.
But then holidays, you get the green and red and all that. So, yeah, it's a lot of fun.
You were talking a few moments ago about some of the older folks, maybe some adults that are having their teeth straightened. You know, maybe they haven't had it. Maybe they've been looking at their teeth for like the last 15, 20, 30 years and they go, you know, it's about time I had my teeth straightened.
Yeah.
Absolutely.
Yeah, and again, with today's technology, you still can use the rubber bands, and even with Invisalign, people who need jaw surgery to correct their jaws, we can actually do orthodontic surgery these days with your Invisalign and rubber bands. You no longer have to only do braces.
That is phenomenal, because sometimes the jaw surgery can be eliminated just by wearing the braces and having,
Yes. Sometimes you'll get all the improvement that you need with just wearing rubber bands, but again, some people who, you know, actually do need the surgery can do it with rubber bands and Invisalign too.
Fantastic. Y'all have a special offer?
Yes, we do.
So we're doing braces right now for $39.95. That's braces and a full Invisalign case, and then you can also do Invisalign Lite for $29.95.
That's a fantastic deal.
Yeah,
absolutely.
That hasn't changed probably in about 20 years. Ladies, thank you so much for coming today. Make sure you get those teeth straightened, that's for sure. We're back in just a moment with more Low Country Live right after this.